54-year-old male with a past medical history of hypertension, diabetes, hyperlipidemia. So as you can tell here, I mean, there is almost like a sequence, right, to strokes. So these patients have hypertension, they're diabetic, they're usually pretty old, like, well, not really old, but you know, they're not 30 or most of the time they're not 40, they're 50, 60, 70, something like that. So this patient here has a history of hypertension, diabetes, hyperlipidemia, as well as claudication in his legs. So that's already telling you this patient has atherosclerosis. Presented to the hospital with focal neurological deficits. An MRI of the brain was done, as well as an MRA were done, which showed signs of intracerebral stenosis. What is the best management here? So these patients actually, or this patient rather, has stenosis or atherosclerotic plaque inside his brain. What would you need to do here? So let me just give you another point. When we have claudication, this is peripheral vascular disease in your legs. You walk, you start having pain, you stop, the pain goes away. So in these cases, you can stent them. If the patient is having angina, similar idea, peripheral or vascular disease inside the coronary arteries. So these patients, you stent them. What happens if you have intracerebral stenosis? You have peripheral vascular disease, but inside your intracerebral arteries. What would you do? So at one point before, they were actually trying to stent these arteries, but they figured out that stenting these arteries actually causes more adverse effects than just treating them medically. So these patients are just treated medically with aspirin and Plavix indefinitely. So you don't put these patients on aspirin and Plavix for 3 months and then you stop or switch. No, you keep these patients on aspirin and Plavix forever.